Welcome back, viewers. Mr. Irfan Akhtar has joined us. So let's welcome Mr. Akhtar. Thank you very much, Mr. Akhtar, for joining us. We were having very enlightening conversation with Professor Umar regarding his vision for Rawalpindi Medical University and his intentions to take the university to the next level. So he's, as you know, he's on a study tour. So where do you see his vision to make the Rawalpindi Medical University the topmost university in the country? How do you see any institution or organizations in UK can do to have this collaboration successfully with them?
So, Assalamu alaikum Amara and Assalamu alaikum Professor Umar. It is such an honor for me to be sitting with Professor Sab. I just want to let everybody know that my journey started with being a student from Professor Umar. Then I was his house officer. Then we were started when I became a registrar. I used to work with him. Then when I took the job of AP, assistant professor, then I was with him. And then he became the principal. So it's such a good honor that I can recollect all those years, starting as a first year student when he used to be in final year at that time, and then going all the way and now sitting with him.
But I'm sure as we are proud of Professor Umar, he's also proud of you, because of course it's always a matter of pride for the teachers to see their students make to this level.
Absolutely. And just to let everybody know that it doesn't come as a gift. Professor Umar has been a very hard worker. I still recall that he would do the morning rounds and then he would just appear when we were about to disappear from the ward in the evening. So we would do our evening rounds. So he knew each and every patient by heart, and he was very involved in that. And I think it is a testament to all his hard work that Rawalpindi Medical College, as we used to call it, has changed into Rawalpindi Medical University, and it is one of the top 2 universities in the whole country. So Professor, I am really very proud. I have worked with you, and I know that when I go back and see the university, it is a changed university now. It is a very modern, very state-of-the-art university now. People take pride, and the competition to get into the university is very, very high now. So I must say that, congratulations to you and to your team, which you have built over the years. Now that we are working here, and how would you see that the doctors, the students and the doctors who have come from that alma mater, how do you foresee that they can help you in immediate short terms and the long term in your vision of developing the university to next level?
Thank you very much, Dr. Irfan, for your kind words for me and for Rawalpindi Medical University. I was just mentioning that it is a teamwork, and the governance nowadays is a inclusive and participatory and sort of collective wisdom, and that's how we are governing the Rawalpindi Medical University. Secondly, the world has become global village. I usually say that disease and knowledge has no boundaries, and we have seen in the COVID that how COVID take the whole globe into the human life crisis. And that was opportunity to learn also where that was a misery. And we understand, and me being the Vice Chancellor of a very promising and fast growing university, that unless we take the internationalization in the medical education, which is called the transnational internationalization, we cannot survive, and we cannot do the justice with our patient and with the trainees. So medical education must improve the quality by this collaboration, and this will lead to the excellence and good clinical practices, which is the first word is doing, and we may be not at that level in the third word or developing word. Certainly when we do this collaboration and come into the quality, then certainly this will increase the safety also, because it is not only the quality, it is not the patient services and treatment, it is the safety also. And I think by these collaborations we can enhance the patient or healthcare delivery system, quality and safety. And secondly, the training of the doctors. Unless we train our doctors at international models with the same skill and knowledge and attributes and ethic and professional framework, I think our doctor will lag behind. And this is the point of collaboration where our alumni and you being the the pivotal man and instrumental man in the Appne and created a great niche for Rawalpindi Medical University in UK. We need your help and collaboration.
Thank you. I think, Professor, you have taken two very important points. One is the training of the IMGs and which we bring them here, and then training back home for people, and then of course the patient safety. These 2 points are very, very dear to me. NHS as we are very short of doctors. We still have about 8,500 doctors, whole-time equivalents missing from the post. So NHS has got about 40% of IMGs. So the IMGs play a very big role. And I think this is a joint collaboration between your university and NHS. We both can benefit each other by us providing them training, but then you guys come up here and then fill up the gaps which are vacant up here. So it kind of starts very beginning, Professor. There is a lot of medical students from the universities here, medical colleges here, who go out and have a flavor of the world and, as they say, to their electives when they go. I see very few people going to Pakistan. Although looking at the university you have, it's very, very well developed. It has got all the facilities, and it's I think over 2,000 bed hospitals with attached to that. So it's a great experience. It would be very naive not to say that we cannot use that thing and people to expose to third world countries and to the medicine over there and the universities there. Is there anything in your plans which we can support so we can let people familiarize with our universities from UK?
Yeah, I think that I mentioned the transnational education, and we have a very concrete plan. And let me give one example. We are already collaborating with the Royal College of Emergency Medicine, and I must mention Dr. Yaz Abbasi and you and your team. This is started 4 years back, and now these people are trained for the emergency care in Pakistan, which was not at that level as you have in the UK. And this training system is entered into the 4-year programs. This is 1-year diploma, and now we have more than 100 emergency physicians of mid levels which are trained by this program, by these collaborations, and they are delivering service. And extending them further, collaboration with the universities and hospital here. A couple of those students who have done this diploma of emergency medicine, dual sort of diploma, they are now improving their further fellowship and other things in the UK. So this is one example. But certainly we want to have exchange program of the students, very structured, the clinical electives. Then we want to the faculty exchange programs. Then we want to run the research grants with your university and your hospitals. And I'm here from last 1 week traveling from Glasgow to Cardiff, going to the Cardiff Metropolitan University in the universities of Glasgow. And yesterday we visited the University College London and Queen Mary. So this is what we are strengthening, and this program is called the Pakistan UK British Council Gateway. And I think I must mention your effort as alumni to bring this collaboration to this level.
And may I just add something where we expect, and this is what normally happens, that doctors who qualify from Pakistani medical institutions, they like to come abroad to actually basically enhance their skills as well as knowledge. And there is a kind of a misconception that the training in Pakistan is not of a high standard, even though we saw in COVID how Pakistan tackled with COVID pandemic much better than a lot of other developed countries. I personally feel that the exchange program is not unilateral, that people coming from Pakistan. I think doctors from here should also be encouraged to go and visit there, so that there's so much to learn from there. And one of the things that I always see is that the hard work the Pakistani doctors they put in, because a lot of times we are in conversation about the quality of life as a doctor. I think in Pakistan, the quality of life concept for doctors is completely different from Western world. So would you think that is something that your collaboration can support?
Certainly. Let me give you another example that College of Physician Surgeon already running a program which is the MTI Medical Teaching Initiative, and there are 400 Pakistani young doctors which are getting training here, and they are not going to stay here. By agreement, these trainings are to increase their skill and knowledge and their capacity, and to get more exposure to the diseases here and technology, and go back home and complete their fellowship there. So this is a unique programs where two countries are collaborating, and they are delivering for the betterment of healthcare delivery system and the training. Regarding the the faculty and the doctors, I think doctors are equally stressed. Maybe it in the Pakistan and maybe the UK.
It's a different kind of stress.
Yeah, it is different kind of stress. It is always burnout.
Yeah.
It is always the time of working, and what you call that. I think the timing hours here.
Yeah.
Same as the doctors. Their salaries, their other issues. They are same everywhere,
Yeah.
because we are dealing with the human life, and we have to work at zero risk, because the human life is priceless. So doctors is one community which always be stressed and which needs special attention by the government, by the society also.
Absolutely.
So, Professor, I think taking the same point a little further, stress. And one of the stresses here is patient safety, and the fear of things going wrong in medicine. Nobody wants that. And then the complaints, and then how do we manage them, and how do we evolve from them by becoming better doctors, bringing more patient safety. So just to give you an idea about NHS, so we have about 250,000 complaints every year from patients. We are a population of only 62 million, and we get about that many. And we, as you are very well aware, we get about 500 never events every year, and that goes about 100 less, 100 more, but about the same time. We have here started to learn to get away or shy away from whistleblowing. We want to shy away from blaming culture. We want to learn and reflect from it, so that each complaint leads into something in terms of betterment of our understanding of the disease process and prevention of that happening to a patient or to a family. So is that something, because you are running a big hospital, I can't even imagine 2,200 beds hospital. So is that something like in terms of governance, which is part and parcel of your future planning, if not already existing?
This is the most important thing, and it goes to the 1,000 years before, when the Hippocrates says no harm first. So benefiting patient, treating patient come after the no harm. So there should be a system of quality assurance, quality enhancements, monitoring and reporting, openness, integrity, honesty. If something go wrong, it has to be reported. It has to be because that's the way to learn. That is the way to prevent it future. What happens is happened. That also a very serious thing. So this is the system we have all at least in the emergency services. Another system we have introduced a pharmacovigilance. That how our the people who are dealing with the drugs, the pharmacists, they become the part of our team, and they look into the things that the doses are proper, the routes are proper, the indications are proper. So pharmacovigilance system has been introduced. Quality safety, there is separate department university has established. There are strong SOPs, guidelines, and monitoring cycle, which is to learn from the clinical mistake, and then go to for its evaluation, and then complete what is called the clinical audit system. So we follow the clinical audit system. And you rightly said the governance is not only administrative governance, it is not only the academic governance, it is clinical governance also, that what are the different competency levels of the consultants and the trainees, and SOPs and their implementation, and then monitoring. So this is a concrete system which is established there. And we are also, when I was visiting the universities, we try to understand their system also. And I think I must mention that how can we prevent the one is digitalization. So if we have automation, if we have a digitalization, if you monitor all this through this system, so there is a chance that we make less mistakes.
Absolutely. I think
safety.
what we have learned over the time is that human factors play a big role in all these things. And we have now started to move away from as much physical notes and physical doctors doing and going into electronic prescriptions. I think if you are looking into that, that would be a great step forward, a great step forward.
And I would like to ask a question about, because of course patient safety is important. What about the support to the doctors? Because of course whenever there is a never event or things go wrong, it's not intentional. Of course these are human errors, or anyone can make mistakes. So is there any support system for the doctors when things go wrong? Because of course the person who is involved in it, they are under a lot of pressure because, and you know, there have been examples where doctors have taken lives when things went wrong and they were kind of blamed for things going wrong. Is there any support system in Pakistani system where these doctors are offered support as well?
Yes, I'm very happy that you have asked this question. And many people have misconcept that possibly we are not working in that. This is a very robust system there. One system is where the doctors have very strong organization, like Pakistan Medical Associations, Young Doctors Associations, and many other who look after this, and they have their own bylaws and how they follow it, any complaint. But at the same time, government in last 15 years have introduced a healthcare commission. So this healthcare commission review all the complaints. Anybody can go to and register complaint to the even police also. And police can arrest any doctors. But after the healthcare commission induction through a legislation, so government has made a legislation, both federal and provincial, that the doctors will appear first. Any complaint will be addressed by the professionals and legal expert in the healthcare commission.
But is there any legislation to protect the doctors? Because every now and then we hear that patients' relatives, they had beaten the doctors and they keep on threatening them. So what protection government is offering? Is there any legislation? Because that should not happen?
Yeah. So you're making the violence against the professionals, doctors, nurses and paramedics. I think it happens everywhere. But obviously, because in a civilized society, in a well-structured societies, and where the systems are, securities are placed, this is less. But in developing country, this is more so because of lack of education, because of the more expectation from the doctors and less awareness. And doctors even have more patient to see, more burden on them. And sometimes it is on their end, they cannot explain to the patient that what are the outcomes, they don't have a time. And the attendants come up with a very high expectation, and this gap of communications, lack of professionalism, lack of the fabric that there should be coordinators in the hospital, there should be the separate department for...
We've got posters in the hospitals, NHS organizations, all institutions of zero violence, zero tolerance to violence. So this is the kind of thing which is about patient awareness.
This is in the place. And addressing their complaint also. The genuine complaint has to be addressed, which are related to the patient and even to the attendants.
Yeah. So one last one for myself, Professor. I'm seeing that the number of people, junior doctors who are wanting to come to UK for training is ever increasing. And I, being a program director, I see that there used to be 2 or 4 tops applications per month before. Now I get more than 10 a week, and we have to close applications within an hour because we get 1,000 applicants. That's how the situation is becoming now. The one thing which I find that as I've seen, and as perhaps Amara has also mentioned, that the basic knowledge, our core knowledge is very good for our doctors up there. But when it comes to communication skills, when it comes to softer skills such as talking about a patient in difficulty, talking about an angry relative, as Amara has just mentioned, or talking about a complication which has happened. You know, nobody has driven to the hospital to cause a complication, but it does happen. We play with fire every day. Is there any mechanism you have put down in place in your university to teach these softer skills of communication skills, of interaction, teamwork between the doctors when they are graduating?
I think that's a very important question, because anybody who comes to the hospital, he's sick. The anxiety level of the attendant is much high as compared to a normal person. So here we make the ethic, professionalism, communication skill, and other soft skill part of the curriculums. At Rawalpindi Medical University, according to the curriculum 2024, we have included into as a competency that it should not be left to the communication skill just as a skill. It is a competency, and it is translated into quantitative form, and it is learned over time. And we make sure when somebody graduates from here, he knows the communication skill to communicate with the patient and attendant. So this is part of their, we are the only university in the country, we put it into the curriculum as a competency, and what is called interested professional competency, like you have. Yeah. So this is how we trained our junior doctors. And then there is a continuous professional development, where the senior doctors even, they come up. Look at the challenge we have now with the chat GPT. Look at the social media. So I think we have established a cell for the social media. Go back when you talk of communication, and now you have a social media. So doctors are not well versed with this. So we have one workshop that how to deal with the social, so this is social media, what to put, what not to put on there, and how to take it as a productive manner rather than get prey of this this social media.
Thank you.
Yeah, very useful to know. So one last thing I would like to know, because it's been decades since I left Pakistan. We used to have these hierarchical barriers in Pakistan. So do you think with time, with social media and exposure to Western world, because here consultants and trainees, they work together, and yes, respect is one thing, but it's not that consultants become gods. So do you see that barrier is kind of is improving in Pakistan as well?
I think this is a very sort of penetrating question. It's a societal issue also. Remember that we are a developing nation. We are not, education literacy level is not that. Our institution maybe at not developed at Dr. Saab said the soft skills, the social skills. And I just forget that Dr. Suhail was mentioning about this thing, and we yesterday night I told that we will establish a chair there to deal with these soft skills. You talk of the barrier, you talk of the hierarchical system and bureaucracy rather. So this bureaucracy is not in the government, it is in the medical side also, it is in the medical education. But we learn that this is a system where it should be objective. So when it comes to the things which are objective, this hierarchical and this academic bureaucracy is also getting weaker and weaker.
It's good to know, but you rightfully said that there is some society norms as well. Respect for elders is one thing, which doesn't mean that in Western world they don't respect their elders, but I still have that, even though I've left the country for so many years, I still would give chair to somebody who's my senior. Yes. So I would not want that part of our cultural norm to disappear.
That's right.
But then again, it's about what you call this, sometimes these things, they become a hurdle in asking for help in situations where they think they need senior help, that kind of a thing. So, I mean, it's good to know that there is a lot of awareness, and people are now following the footsteps of modern world. I wouldn't say Western world, modern world, and because
improved
this is,
world, I would say.
Teamwork only demands that everyone works together, and they work as a team rather than like, this is my senior, this is my junior. It's just taking their responsibilities, seniors.
That I also said that our wisdom, if somebody asks me what is the model of governance in Rawalpindi Medical University, so I say it is the model of inclusiveness, participation, and collective wisdom, and team wisdom, not as bureaucratic model of Vice Chancellor.
I think that's a great end to the show. Thank you very much, Professor Umar and Mr. Akhtar, for your wisdom. And I'm sure where Rawalpindi Medical University stands now, we'll see it reaching more heights.
Thank you,
once
Amara.
again.
Thank you very
Professor.
much.
Thank you.
So, viewers, you heard very dignified guests today, Professor Umar and Mr. Irfan Akhtar, and I'm sure the show was as enlightening for all of you as it was for me. So, we'll be back with another topic next time. Goodbye for now.